Good evening and welcome. You're watching Left, Right and Centre. I'm Natasha Jog. India's health report card is now out. We ask, can this assessment help transform India's ailing health sector? Our special guest, of course, CEO of NITI Aayog, Amitabh Kant, joining us in just a bit. But first, just let's lay the groundwork on what we are looking at this evening. Like I said, the country's health report card is out. No big surprises at the top. Where sits Kerala when it comes to overall performance in the health sector? And Uttar Pradesh is at the bottom, but has made some annual incremental gains. This is the first of its kind study done by the central government, developed by the NITI Aayog in consultation with the Health Ministry and with assistance from the World Bank. This is the rankings that have been done in three categories: large state, small states and union territories. But as you can imagine, it's a complex report, just like the sector it represents. Kerala is first, but it shows a steep decline when compared with its previous year's performance. In contrast, Uttar Pradesh, that's at the bottom in the group of larger states, ranks third in terms of annual incremental performance. Jharkhand is the biggest gainer in this category, followed by Jammu and Kashmir. Among the smaller states, Mizoram ranks first, followed by Manipur on overall performance. In terms of annual incremental performance, Manipur is on top, followed by Goa and Meghalaya. Lakshadweep is the top performer among union territories, both in terms of overall performance and annual incremental performance. But how does this play out, especially coming at a time when Modi Care is being discussed, when it is being debated, and the rollout, of course, is set for this year, October being the deadline for NITI Aayog. Well, the man who is in charge and playing a key role in rolling out Modi Care, who's involved in this report being released today, CEO of NITI Aayog, Amitabh Kant, who spoke to us a short while back. Thanks, sir, for speaking to us. You know, you spent so much time on this report, preparing it, now analyzing it. Many would argue that, we know that Kerala would be on top, UP would be at the bottom, despite that sparring between the chief ministers that we saw on whose healthcare is better off. But what do you believe is the silver lining, and where have the challenges been identified?
Well, I think the most important thing is that the eastern part of India, and that is states like Jharkhand, Uttar Pradesh and Jammu and Kashmir, these three states have shown a remarkable incremental improvement. It's important to capture change, to capture the delta, because what we've done is we've not merely looked at historical data and seen how states have performed, but also seen during the course of the year which are the states which have done well, and these are amongst the bigger states. These are Jharkhand, UP and J&K, but amongst the smaller states, it's Mizoram which has done well, and amongst the union territories, it's Lakshadweep which has done very well.
Okay, but the big question is, do states really have a buy-in when we're talking about Modi Care? And we've seen what you've done today. You've identified the lacunae in the system, who's done well, some encouragement there, but identified areas on who needs to do more, what are the areas you need to do more, and all of that. But do states, you believe, have a buy-in? They're, of course, mandated to now that, this is a central government initiative, but do you believe that they're going to put their best foot forward on this?
Yeah. You see, the great thing, what this government has done is really bring health. Health has been brought center stage. And if you look at historical data which this brings out, it shows that Kerala, Tamil Nadu and Punjab have historically done well, but other states are now catching up. 15 states have shown an incremental improvement. And what it's showing is that health is increasingly becoming a political and an administrative priority. And this budget, the government has really unfolded the fact that we'll be developing 1.5 lakh primary healthcare centers. So the government has taken the responsibility of primary healthcare. And in India, 8 crore people go below the poverty line because the out-of-pocket expenditure is very high. And therefore, for the tertiary care, once you've taken care of people at the primary health care, then at the tertiary level, the government has brought about this assurance model it's not really an insurance scheme, but it's an assurance model where the government says that it'll, up to an amount of 5 lakhs, it'll take care of people. And all states 24 states actually have smaller schemes, but they all work in partnership with the center to take this forward. So there's huge interest, there's huge enthusiasm, and center will work with the states to take this forward.
Okay, one can really understand the interest and really the enthusiasm also. This is something that we really hope works. This is what India needs. We know the state of healthcare in the country, but while people are welcoming NHPS, like you're saying, now how different is it from its predecessor? This was the Rashtriya Swasthya Bima Yojana, and now parallels are already being drawn to it. Many states pulled out, they dropped out, they came up with their own version. So do you believe that that's going to be a problem? How different is this?
So, Natasha, first and foremost, a lot of homework has been done on this. A lot of due diligence has been done. We've looked at all the successful schemes internationally. We've looked at the good ones domestically. We've looked at all that has been done in the past, and that's why this particular scheme makes a quantum jump. It goes up to 5 lakhs, and and to my mind, what will happen as a consequence of this is that state schemes will get subsumed under this, and this will really be a game changer in many ways, because the modeling that has been done is based on good experience, good practices. It's a lot of learning of past experiences which has been put into this.
Right. I'm sorry to just keep focusing on the detail, and it's important, of course, to underscore that we're all backing this, hope that this works. This is what India needs. But I have to ask you, for instance, the Rashtriya Swasthya Bima Yojana, the one that I mentioned, had provided a coverage of only 30,000 rupees. Now we've seen it up to 5 lakhs according to NHPS. Now, what really is the actual that will have to be paid? How much is it? Will 1,000 rupees per household per year, what the NITI Aayog is talking about, be okay for a cover of 5 lakhs? Do you believe that these kind of questions are going to sort of be ironed out in the near future?
But why are you looking only at NHPS in isolation? I mean, look at what the budget talks about in entirety. Firstly, it talks about primary health care. It puts the onus on primary health care. And it says that we'll create 1.5 lakh health and wellness center. And this that means the government takes the responsibility of primary health care, which is what it should be across. And secondly, it says that for tertiary care, it brings in an assurance mechanism. And thirdly, it says that 24 district hospitals will be taken to the level of medical colleges. And fourthly, when you back it up with what we are attempting to do in terms of institutional restructuring of the Medical Council of India to ensure that there is many more doctors who are available, who come into the system. And fifthly, by creating the sense of competition among states, once we start ranking states, we start naming and shaming them, we start saying that good governance is good politics, and we start saying why some states have done better than the others, the sense of competition will ensure that states radically take measures to improve their performance in health. And I'm extremely optimistic with this package. The expenditure will go up on health, and you will see radical improvement at the primary health care level.
Okay. One last question. So, the focus also been on how this is looking at secondary and tertiary. It's primary that we need to look at. You have addressed that to a certain extent, but how many years do you believe it will take before this actually starts working on the ground?
No, we are all working towards it. It'll be impractical to give timelines for this. We are all working. A lot of hard work is going on behind this. The Health Ministry, the Health Minister, NITI Aayog, our member Dr. Vinod Paul, who's a public health specialist, all of us are working towards a quick rollout. But to give defined time frame is not a correct thing to do. Yeah.
Great. You clearly have your task cut out. All of you are working towards it. All of us hoping that it does work out. This is, of course, a real urgent need as far as transforming India's healthcare is concerned. Thanks very much, Mr. Kant, for your time this evening. Let me now introduce my other panelists to you. I'm joined by Dr. Srinath Reddy, President of the Public Health Foundation of India. Sujata Rao, former Health Secretary, is with us, as is Dr. Pavitra Mohan, Secretary, Basic Healthcare Services in Rajasthan. Thanks all so much for your time. Dr. Reddy, let me start by asking you first, and let's start by looking at sticking to our focus this evening, which is on this state health report card, or India's health report card that you have seen. We heard Amitabh Kant just say the idea is that it's like healthy competition between the states. Would you agree, sir?
I would agree, because actually there are three domains that are being looked at in this report. It's looking at health outcomes. It is looking at key processes in terms of health system functioning. And also it's looking at the overall governance. For example, it's looking at something like under 5 mortality rate, which also has to take into account water, sanitation, nutrition, and many other things. It is looking at system process indicators like what is the average occupancy level of 3 key state functionaries in the health system. How much time does it take for the money to be transferred from the treasury to the implementation agency? So there are many things that have been built into this. So ultimately, you will have to look at the performance of the state government as a whole, not just of the health ministry. And if we actually capture that as an important development metric, then we will be able to say how it is actually improving the health indicators of the state. And you can encourage the states to perform better compared to their own past performance.
Dr. Pavitra Mohan,
according to the National Health Policy.
Right. Sorry, sir, I'll just take that to Dr. Mohan. He's representing Rajasthan as the Secretary of Basic Healthcare Services there. Dr. Mohan, I want to ask you, how do you see this report really playing out? I want to understand from the state's perspective, do they really have a buy-in? This is important because we are now looking at the months and years ahead of Modi Care, of this very ambitious scheme coming up. So do you believe that the states do have a buy-in, sir, into this?
So I think before I go to the question of the state buy-in per se, I think let's look at what the report really is. I think what is important is that it compares the indicators of 2014-15 versus 2015 and 16. So it's not a historical data versus the current data. It is two consecutive years, which are both in the past, right? Secondly, it, as Dr. Reddy said, that it includes 3 domains. But for the smaller, there are several issues with the data, especially on the data related to outcomes, like mortality. The smaller states and UTs do not have that data, and therefore was not included in the report at all. There is the HMIS data and program data, which is largely self-certified and has not been verified from the field. There are also some indicators, such as the indicator of TB case notification rates, etc., which are, again, there is a problem, there is a technical issue with it, that it is based on the total population, and therefore a state which has lesser prevalence of TB will have a worse kind of an indicator. So I think keeping all that in mind, one has to see this very carefully. And the point that Mr. Kant made in the beginning, that the states are catching up, I think it is a bit premature to say that based on comparison of 2 years. For example, if you look at Uttar Pradesh neonatal mortality in 2015 and of Kerala, where when we're saying that they seem to be catching up, Uttar Pradesh still stands at 31 per 1,000 live births as opposed to 6 of Kerala. So it will take a long time to catch up. So based on this report,
I want to interrupt you there. I want to take this back to Dr. Reddy. I'm just coming to you, Sujata Rao, ma'am, but I want to take this back to Dr. Reddy. Respond to what you're hearing from Pavitra Mohan this evening. That is it really fair to compare these executive years that he's talking about? What about the data left out? What about the kind of issues that he says that are existing with this kind of data collection, sir?
Sure, it's actually a beginning. I don't think we ought to draw major conclusions from this at this stage. Whether it is to track the progress of the states vis-a-vis themselves or comparative performance one against the other, or contributing to the overall progress towards the Sustainable Development Goal targets, you need a composite metric. And what this is trying to do is to build that kind of an index which can compare year after year. And remember, in the National Health Policy, as well as in the National Health Mission Plan, it is proposed that a small fraction of the money would actually be awarded to states on the basis of their incremental improvement as a performance incentive. So whether this particular index can be improved upon, certainly. For example, non-communicable diseases are missing, financial protection indices are missing. That's because the data are not existent. As these data are gathered, the index has to be strengthened. Okay. But at least in order to track progress, it is very important. But I don't think we ought to draw major conclusions at this point in time, other than to say it's a good beginning as a progress tracker.
Okay, Sujata Rao, I'm hoping that you can hear me, ma'am. Come in here. Do you believe that get states to compare their health indices in this fashion is a good beginning? The point, of course, that Dr. Reddy is making, Pavitra Mohan's point, of course, on the program is that it's still not enough. But again, the subtext seems to be that let's not get ahead of ourselves here. There are perhaps important lessons or indicators here. Where would you stand, ma'am, on this?
Natasha, I couldn't, voices were breaking, so pardon me if I'm saying the same thing. First of all, my comment is that it's a good beginning that at the national level we are doing this ranking of states, but it's something that we tried to do also in 2010 when we gave awards to Assam and to Tamil Nadu and so on for the best outcomes in the NRHM program. But the problem here is what is it that we are trying to achieve? I'm not very clear. We all know you can't compare Jharkhand and Kerala. Kerala is about 50 years ahead of Jharkhand. So if this data, there are 2 points I would like to make. One is if we can improve our registries and improve our data systems at the state level and more importantly at the disaggregated level of districts, because a large number of intra-districts and inter-district variations, and then it can be really useful as a planning tool. So that's one. The second is at the macro level, at the NITI Aayog level, is it possible for them to come up with a formula of central funding based on this kind of ranking where they give a far higher central assistance to states like Jharkhand and UP and so on to do the catch up? Without central assistance, you have to remember that these poor ranking states are also doing badly largely because they don't have the resources. They have a huge historical legacy behind, and to catch up with states like Tamil Nadu and Kerala, they need help.